Welcome back, everyone. In our golden years, we hope to be treated with respect and dignity. But for many LGBTQ+ seniors living in long-term care, they face more discrimination than acceptance. That's why I was so excited to visit the Rakai Center here in Toronto. They have the only rainbow wing in all of North America, which is a wing dedicated entirely to LGBTQ+ residents. Take a look. Barbara, you first got the idea for the Rainbow Wing in 2008. What inspired you?
So what inspired me was one of our residents. And the resident came to me and said, disclosed that he identified with the community. But what triggered me was his grip on my shoulder. And he pleaded, just don't tell anyone. Oh. And that hit me in a way that I've never been hit before. And I knew this was a new venture for me.
You have a Champions program that trains staff on how to make safer spaces for residents. Can you tell me about that?
It's about how the champions are prepared with resources, how they can answer the questions and be the ones when there's trauma, to be the person to go to. And they can go in silence. They don't have to say, I'm gay and I need support, or I'm queer and I need support, but they can go to that person because they're identified by a pin and a sticker.
Right.
And they're a safe person.
David, you were living here in this residence and got to see the Rainbow Wing sort of come to life.
Yes.
It must be gratifying to live in a place like this where you can be yourself.
It is nice not to have to worry about some of the things that happened to me.
Is the Rainbow Wing sort of where a lot of the fun happens?
In the last month, I have had a much happier experience. It's more that I have become part of the whole establishment and feel at home.
Is there an event or a day of the week you get especially excited about?
Well, I enjoy going to bingo.
It's a classic for a reason.
Yeah.
Do you ever win at bingo?
Well, I usually do.
You win some, you lose some, right?
No, I lose some, I win a lot.
Danielle, you are the manager of programs and volunteer services. Is there a program that is near and dear to your heart?
Oh yes, it's my cabaret program that I run. We have it in the evening, and it's like I'm trying to recreate what it was like when our residents were younger and going to the clubs. I think part of the whole purpose of the Rainbow Wing is just bringing that culture. It's bringing that culture here, right, and making our residents feel like they haven't really left the community.
Are they a tough crowd?
No, they love the party. They love the party. They love the party.
Neville and Charles, how long have you two been together?
15 years.
15 years.
16 years. I made him promise he would give me 10 good years, and he did.
And he did.
And he did, before he had to come here. Before I couldn't take care of him.
You couldn't do it.
Yeah.
What does it mean to you that Neville is in a residence such as this?
It's great. I don't have to worry. They care for him.
There's a lot more trust for you, though.
Yeah. I have a lot of trust for the people here, a lot.
What are some of the activities that go on that he gets included in?
One of them was a drag queen brunch. I try to get him to go to all the outings that I think are interesting.
When you two came into this room, it's like Neville saw the camera lights. Look at that smile. It's $1 million smile, truly.
All smile.
All smiles.
Beautiful. And I, for one, had no idea that existed, and I'm sure many people didn't know. And the Rainbow Ring exists for a reason, to challenge discrimination against the LGBTQ+ seniors in long-term care. To chat more about that issue, educator and gay rights advocate Maurice Tomlinson is back on the show. Nice to see you.
Thanks for having me again.
Oh, we're thrilled to have you.
Now, Maurice, advocates say that although more people are out of the closet today, it's still difficult for many seniors to be open about their gender or sexual identity. Why do you think that is?
So it's very easy. If you imagine you were vulnerable and weak and sick, and you depended on people to provide care for you, and you're not sure how they're going to treat you because of who you are or how you love, you're going to want to do everything to keep yourself safe. And that is why many people we're finding go back into the closet, because they are too weak to defend themselves from violence, from discrimination, and so they just sacrifice that essential part of themselves just to be safe.
Oh my God.
So this discrimination is happening in long-term care homes across the country. So give us an idea about what that sort of looks like.
So it can be subtle and also very graphic. We know the physical violence, the verbal violence, but we're also seeing instances where people who are pre-op trans, for example, don't disclose about their private care needs. And so they don't get that care down there, and things fester. They can get sepsis because they are just not willing to accept care from people they don't know how they'll respond. And we're also seeing a lot of, unfortunately, conservative responses from some of the caregivers that may be subtle. You know, they talk, they may act out, because some of the people we're working with as long-term care providers, this was normalized for them. This abuse was normalized for them.
Wow. Now, you also work as a registered practical nurse in a long-term care home. And you say you make the point of outing yourself to residents. Why do you make that choice?
So I find that for many of the persons in the long-term care who may be LGBTQ, they do not want to out themselves because, again, they're fearful. But when they see somebody that is a part of the community, it's like a light bulb goes off, you know, and they feel safe. They are able to be relaxed. They're able to come forward, and I can provide better care. That's the fundamental issue for me. I must be able to provide better care. And I'm curious in terms of the numbers of persons that are represented in homes, because we don't see that data. And yet we know that statistically 3 to 10% of the population is LGBTQ. So the absence of these persons, the invisibility, is something I want to, you know, explode.
Of course.
So that they can feel comfortable, they can feel, they can access better care.
So we know that isolation is sadly common for many long-term care residents, but the role of the community for LGBTQ+ seniors is actually unique. Can you explain a bit more about that?
That's easy to explain because back in the day, many of those individuals weren't allowed to have families. They weren't allowed to marry, they couldn't adopt. And in most cases, we're finding that in long-term care, getting your regular family to come visit is tough. But when you don't have any family, that's compounding the issue. And then many LGBTQ people lost family members due to the AIDS pandemic. So they're really alone. So they have to create chosen families. So we need to work really hard to keep them safe by allowing them to feel that they're a part of this establishment, as was said in the Reiki interview, which I thought was great.
Oh, good. You say that better training is key, but have you seen any progress in the time that you've been doing this?
It's for me, it's a complicated issue because I have seen some performative signs of progress, you know, pride flags now and here and there. But in terms of the systemic change that needs to happen, I'm concerned that that's not happening across the board because complicating factors, we don't have enough staff, you know, the healthcare system is underfunded. And there's not an understanding, I think, that discrimination can present as clear a health risk as anything else. Because as I explained, if people aren't safe or comfortable expressing themselves, they won't tell you about their healthcare needs.
That's right.
And that can lead to serious health complications and death.
When we discuss LGBTQ plus rights and discriminations, the irony is that seniors often get left out of the actual discussion. Why do you think that is?
Because growing old isn't sexy.
Yeah.
That's the bottom line. And when you think of pride images, it's the young, vibrant, you know, persons. We don't see the people who laid the foundation. We don't see images of, you know, those who fought for the liberation and the freedoms that not only LGBTQ people have, but all Canadians have because of the work they've done. So it's sad that we have to rediscover the contributions of these individuals and bring it to the fore and ensure that their sacrifices aren't in vain.
Yeah. Listen, there's little to no resources or guidance for LGBTQ+ seniors seeking safe long-term care homes. So you say that seniors and their loved ones should start by actually asking the right questions. What do you mean by that?
So that means when you're going to the long-term care home, you should first ask are there any members of the LGBT community here? Because remember what I said, statistically, 3 to 10% of the population is LGBTQ. So if nobody's there identifying as LGBTQ, either as staff or as a resident, that should be a red flag. They're not safe coming out. And would you be safe in that environment? You should also try to speak to the persons who do identify. What has been their experience? And if you're being refused access to these persons, they're not allowing you to speak to them, then that again is a red flag. And I know the new rules sometimes prevent you from having a choice, but you can at least make sure that the limited choice you have is a safe one.
Maurice, thank you so much for being here and having this
That's
really, really important conversation. Wow. Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.